evening, Mr. Oldham. My name is Melissa. I'm the nurse practitioner to see you in the clinic today. Thanks for coming in. I'm going to start with a physical assessment of you, a head to toe assessment, okay?
Okay.
Perfect. Alright, so I begin my physical assessment by just doing a general overview of the patient. And we begin from head to toe, so we're going to start with the head. So I'm going to look overall head, feel the skull, which is normal cephalic. The skin on the face is even. He's well groomed. His skin is normal for his ethnicity, and no swelling or edema noted. And the hair distribution is normal. Nice head of hair. No signs of hair loss. Texture is normal. Okay, so I'm going to move on to the neck. I'm going to feel the neck. Neck subtle, midline. I'm just going to ask you to move your neck up and down for me. Then side to side. Okay, and then we're going to tilt your head. Try to touch your shoulder with your ear. Just move your head towards your shoulder. Yeah. Move back. And move down again. Try to touch your chin to your chest. Perfect. Full range of motion in his chest. Sorry, in his neck. Next, we're going to palpate for the lymph nodes. So I'm just going to stand behind you. Just going to feel that. No tenderness noted there. I'm just going to feel your thyroid glands. Can you swallow for me? Okay, thyroid feels normal. The trachea is midline without any masses. The thyroid was felt. The isthmus of the thyroid was palpable. The lobes were not felt. Okay, next I'm going to move on to your eyes. I'm going to do this little checkup on your eyes. Sclera is white, no discoloration. Conjunctiva is clear, no obvious exudate or hemorrhage noted. Take a little look into the light here. Looks really good. Pupils equal and reactive. Measures about 4 millimeters and constricted to 2 millimeters. And where's that chart? I'm gonna have you read something for me. Alright, can you read the last line on the bottom of this chart? To look this way. It's not in the camera. You read the last line.
LTFPH.
Alright, perfect. 2020. Okay. So I'm just gonna measure the conjugation and conversion of the eyes. So just follow my finger for me. Just keep your head straight ahead and move only your eyes, okay? Okay, look straight ahead as far back as you can. Okay, and look at my finger. Okay, perfect. Normal convergence and conjugation of the eyes. Now we're going to move on to your ears. So we begin the assessment of the ears by looking externally. Oh, the ears are attached normally to the head. Palpate both ears. Any tenderness when I palpate your ears?
No.
Okay. How about behind your ears, the mastoid bone?
No.
Oh, perfect. I'm just going to take a look inside. Ears look normal. It's a little wax. The tympanic membrane is pearly gray. No redness. The abnormalities noted there. Same on the right. Some little wax with the membrane to paint. The tympanic membrane is fairly gray. No normal exudate, no swelling, nothing noted. Perfect. Okay. And then gonna move on to the nose and sinuses. So I'm just gonna, like, perfect. Okay, both nostrils clear. No tenderness. Sinuses. Don't feel tender. Any pain when I touch your sinuses there? Okay. And I'm just gonna take a look inside the nose. Okay. Mucous membrane is pink. No sign of inflammation, no congestion or swelling, no bleeding. And the sinuses were non-tender. Yeah. Gonna move on to your mouth. Can you open mouth for me? Okay. Moist pink mucous membrane. All teeth present. No cavities. Okay, tongue is midline. Can you say ah? Open wide, flatten your tongue towards. Perfect. Uvula is central. Line. No swelling, redness, or exudate noted. No gingivitis. And no lesions. Alright, so we're gonna move on now to the respiratory system. We're gonna start by just observing his breathing is normal. No unlabored breathing. Chest expansion looks equal. Alright. Begin. Alright. I hate this cough for me. Okay, perfect. Alright, so listen to your lungs. Just take normal breath. Deep breaths. Take deep breaths in and out. Good. Perfect. Okay, sounds good. Alright, lungs are clear. No adventitious breath sounds heard. And then I'm going to listen one more time. And while I'm listening, I just want you to say E, like a long E, okay?
E.
Okay, sounds good. No egophony noted. And then for the same thing, I'm going to ask you to say 99.
99, 99, 99, 99, 99, 99.
Okay, good. And then we're going to move on to, okay, this time just whisper 99. Okay, perfect. I'm going to auscultate from the back. Alright, same thing. Deep breaths in and out. Okay, lungs are clear, equal bilaterally. And the same hand, just leave that long E for me. Okay, okay. 99.
99, 99, 99, 99, 99, 99, 99.
Okay, and then whisper 99. So, the posterior lungs are also negative for any egophony, heard bronchophony, muffled, indistinct with repeating 99, and the whisper pectoral, okay, was heard, was not heard. Okay, so now we did the 99, great vibrations were heard, and then we're going to just assess for diaphragmatic excursions throughout the lungs. I'm going to percuss. Alright, I'm going to face the camera this way again. Alright. Nice breathing. Alright. Okay. Good. Okay, so lungs were resonant and diaphragm dissensions were 4 centimeters bilaterally. Alright, so we're going to move on to our cardiovascular assessment, and for this, I'm going to have you lay on the bed over here. Just getting my ruler. So we're going to begin assessing the cardiovascular. I'm going to elevate the head and then turn your head slightly to the left for me. Yeah, perfect. And we're going to measure for the jugular vein venous pressure. Jugular venous pressure. 3 centimeters above the sternal angle with the head a bit elevated. Alright, palpate carotid artery. Just look straight ahead. Do them both. Okay. Carotid artery bilaterally, a +2, both sides. You just check your capillary refills. Okay. Okay. Capillary refill less than 3 seconds. No sign of edema noted to the extremity. I'll listen to the heart sound, starting by auscultating the carotid artery. And just lift your arm. Perfect. carotid artery is brisk without any bruising. And then just gonna listen to you. Straight. Okay. Okay, perfect. Heart sounds are normal. S1 and S2 with no murmurs. Regular, just heart rate and rhythm. Heard the maximal point of. Okay, perfect. Okay, now we've completed the cardiovascular system. We're gonna move on to the GI, the abdomen. So we're gonna start by just taking an overview of the contour of the abdomen. Abdomen is flat, normal shape. Skin is clean, dry, intact, normal, no discoloration to the abdomen. Here with some bowel sounds. Okay. Alright, just put your arms to your side for me. Okay. Positive, normal, active bowel sounds are in all four quadrants. Alright, we're gonna percuss the abdomen. Okay. Normal tympani heard over throughout and dullness over the liver area, which is normal. And we're gonna palpate the abdomen. So start with some light palpation. Okay. Any pain when I do that? Perfect. No tenderness. And then we're gonna speed palpation. No any pain when I do that. Okay. About done here. Okay. No pain. Okay. So the abdomen is soft, non-tender. I'm gonna ask what can you sorry, I'm gonna do the light palpation again. I should ask you to take a breath in and exhale. Okay, perfect. And alright, I'm gonna feel for the aortic over the aortic artery. Okay, normal. No masses felt. No signs of aortic aneurysm. Okay, and then we do deep nation. Okay. No rebound tenderness, negative Blumberg sign. And then the left quadrant. Okay. Negative for Robson sign as well. Right, so I'm gonna be lifting your leg, so just let me take control of your leg, okay? We're gonna do the soul sign. I'm gonna lift. Where's my hand? Oh, it says right. Okay, use the right knee actually. Alright, I'm gonna raise it. And you tell me if you feel any pain when I do that.
No.
Okay. Alright, and we're gonna bend your knee here and flex. Any pain when I do that?
No.
Okay. So negative soul sign and negative for any for the obturator sign as well. Alright, so I'm going to check for Murphy sign, okay, and tell me if you should feel a little tender, but because me pressing down, but it shouldn't be painful, okay. And then take a deep breath for me. Okay. Okay.
No.
Okay. Negative Murphy sign. Well, so we've completed the abdominal assessment. The we're not gonna look at area, but any problems with urinating, any pain on urinating, burning,
No.
Have you noticed any like sores, anything in the genital area?
Nope.
Everything's normal?
Yep.
Okay. And any increased urinary frequency, urgency, or anything like that?
Nope.
Okay, sounds good. Alright, next we are going to go on to the musculoskeletal system. Okay, so I'm going to ask you to sit up for me. And just, maybe it's better if we do it on the stool again. We can get a good, perfect. So I'm going to ask you to just lift your arms straight in front of you, okay, and over your head.
You don't need to bring the camera.
Thank you. Thank you, my assistant. All right, do it again. Okay, arms straight in front of you, then lift your over your head. Okay, perfect. Now raise your arms, like stretch your arms like behind you. Just checking for range of motion. Okay, and then cross your arms in front of your body. Okay. All right. So hold your arm up like 90 degrees, both arms. 90 degrees.
Like that?
Yeah. And then slowly lower them. Okay, perfect. And then, so we're going to do another test. It's called the empty can test. So elevate your arms like you're pouring out a can of soda or something. With both, yeah, you can do both of them. And then, so yeah, so, and then keep your arm down and your thumbs down. And then try to resist me from pushing your hands apart, okay? Resist me. Perfect. Good. And then we're going to move on. Alright, and check just the range of motion in your elbows. Okay. Okay. Good. And do the same thing in your wrist. Just like, okay. Range of motion is good. And then spread your fingers apart like that for me. And then bring them back together. See how we, yeah, perfect. Good range of motions in the upper extremity there. Okay. And then I'm just going to do called the talons test. Please tell me if you feel any pain or tenderness when we do that.
No.
Okay. This test is really done for a carpal tunnel. There's a nerve right here that usually is very tender when it's pressed on. Okay. And then the next one. So range of motion is good in bilateral upper extremities. And we're going to check the back. So turn, actually, stand up for me. So I'm going to ask you to stand up and then bend and touch your toes. Okay, again. And then just rotate from side to side, just checking the range of motion in your back. Good. Okay. And then I'm asking you to lay back on the bed and then bring your legs straight up. And lift your legs up and down. Okay. Again. Great. Okay. Then try to bring your knees to your chest for me. Okay. Good. And lay face down for me on the bed. And extend your leg up for me from your hip. Okay, and down. Okay, alright. The back's good. And then I'm gonna just test your hip. And just bring your hip in and out. Good. Okay. Good range of motion in the back. So you could go back up on your So we're gonna test just the range of motion in your knee. So bend your knee for me. and try to bring your foot to like towards your back.
Okay.
And the same thing. Perfect. You can straighten your knees again. Let's check the range of motion in your legs. Okay. Perfect. And toes. Everything looks good there. Alright. Now rotate knee. Okay. Alright. Positive range of motion in bilateral lower extremities. Alright, so we're all done with the musculoskeletal. We're going to move on to the neuro, and we're going to do the final section with the neuro. We're going to do that from the stool. Okay. Alright, can you tell me your name and date of birth?
Ryan Alden, November 9th, 1992.
Can you tell me today's date?
It's January 12th, Wednesday.
Okay. And the year?
2022.
Okay. And who's the president?
Joe Biden.
Okay. Well, patient is alert and oriented, speech is clear. And okay, can you tell me why we're here today?
For checkup.
Okay. Alright, so we did do the cranial nerve 2, 3, 4, and 6 in the beginning of the assessment when I assessed the eyes and the so when I did the ears, nose, and throat, we kind of did a lot of the cranial 2, 3, 4, and 6. I'll just have a overview of that. Okay. Yeah, so we did the olfactory, this is the nose, which your nose is intact. And we can do a little smell. We'll just do a little smell test. Can you close your eyes? Maybe what you smell?
Soap.
Yeah. Okay. Alright, and then we did the optical, the eyes. And yeah, we did the 6 cardinal gazes, conversion. Perfect. Okay. So we're gonna do cranial nerve 5. Can you raise your eyebrows for me? Okay. Perfect. And keep your eyes closed. I am going to stick you with something sharp, then something dull, and you tell me which one it is. Okay?
Sharp. Dull.
Again.
Dull. Sharp. Dull. Sharp. Sharp.
Okay. You can open your eyes. I'm just going to test your corneal reflex. Okay. And can you smile for me? Perfect. Puff out your cheeks. Okay. Close your eyes really tight. Perfect. Cranial nerve. That was a facial nerve. Cranial nerve 7. And then we're going to move on to the hearing. Cranial nerve 8. I am going to whisper some 3 numbers and repeat them back to me, okay?
4, 7, 8.
Okay.
9, 10, 11.
Okay, perfect. Okay. And okay, what is the weather like today?
What's the weather today?
Yes, yeah. Just checking your speech. Speech is good. And we're going to do a little test on your gag reflex. So I'm going to use use this cotton swab. Alright, so you're going to say ah for me, and I'm going to try to elicit gag reflex. Yep. Perfect. And then We're gonna go on to cranial nerve. We just did cranial nerve 9 and 10. We're gonna do cranial nerve 11. Alright, so I'm gonna just push up against my wait. Okay, perfect. And that was cranial nerve 11. We did the shrug test, and then you stick your tongue out for me. Move your tongue side to side, up. Perfect. And that was cranial nerve 10. And we've completed the nerves. So now we're going to assess for your gait. So I'm going to ask you to take a stroll. It's a little stroll from where you are. Want me just to assess your gait. Let's see. Go ahead. Yeah, just walk. Alright, you're fine. Your gait is normal, and then walk back to me. Okay. And then now we're going to do the rumble test. You're going to stand still, feet together, and hold your hands out right in front of you with your eyes closed. Alright, perfect. No swaying. Negative rumble test there, and then we're gonna same thing with your eyes closed but palms up. And I'm gonna just test for drifting. Perfect. Good. And negative pronator drift. And we're gonna just assess for muscle tone and bulk. Good muscle tone is good. Good strength in the arms as well. Okay. You could have a seat back on there. And then you're going to do some sensory nerve assessment. Similar to before. Alright, so this, we're going to do a sharp and dull test again. So this is dull. This is sharp. Okay? Alright. Now with your eyes closed. Tell me what I'm touching you with.
Dull. Sharp. Sharp.
Yeah.
Dull. Dull. Dull.
Try again.
Sharp. Dull. Sharp. Dull. You hit my shirt. Dull. Sharp.
Okay. Okay. Looking at your eyes closed again, and I'm going to just move your fingers in a direction and you tell me if it's up, down, side, left, or right, okay?
Up. Left. Sort of to the right.
Okay.
Up. Down. Right. Left. Down.
Okay. And just give me your toes. Same thing. Tell me if it's up or down.
Up.
Or side to side.
Right. Left. Down. Up. Down. Right. Left. Down.
Perfect. And that was the proprioception, positive proprioception. And I'm going to write a number in your palm with your eyes closed. Tell me what the number is.
3.
Perfect. And
8.
perfect. That's correct. And so normal distinction with eyes closed. Alright. Last thing we're going to do. Next we're going to do some deep tendon reflexes. You can open your eyes. Put your hold your hand down. Okay. Normal reflex. do the tricep and the bicep. Okay. And that's normal reflexes. There. Do this one. That's the I'm gonna check for a Babinski sign. Just gonna lift your feet, stick your foot up for me. Okay. Normal Babinski sign. Okay, so hold your hands out. I'm gonna ask you to like rapidly tap between your index finger and your thumb. Okay. Yeah. Okay. Okay. Great. So try to touch from your finger to from your nose to my finger, wherever my finger goes. Okay. Perfect. Yeah, let's get it on video. Perfect. And the last thing we didn't do was the Koenig sign. Okay, let me check the Koenig sign. So we're gonna flex the leg and hip. Slowly. Any pain when I do that?
No.
Okay. Okay, negative Koenig sign. So I think we have completed our physical assessment. Thank you for being here today, and I'll look forward to seeing you again.